Hey everyone, and a very warm welcome to this explainer. I am absolutely thrilled you're joining me today because, wow, we are looking at something incredibly powerful. We're going to explore a modern, non-medication-based therapy that is genuinely changing the entire landscape of mental health care. So for anyone out there who has ever felt like they're just running out of options in their battle with depression, this explainer is absolutely for you. We're breaking down the science and the very real success behind TMS therapy, and we're going to do it step by step, starting right now.
But, before we get to the science, we really need to acknowledge the reality that so many people face. What happens when standard depression medications fail? For millions of folks, this isn't just some theoretical question. It's a frustrating, exhausting, and often downright hopeless daily reality. Trying medication after medication, dealing with all those heavy side effects, going to therapy, and still waking up under that heavy cloud of depression. It's a tremendous burden. And it is so important we validate that experience before we even talk about the solution.
Okay, let's dive right into this. Today, we're covering when medications stop working, what TMS therapy actually is, how magnetic pulses rewire mood, what safe sessions look like, and finally, some real patient success stories.
Section 1. When medications stop working.
So when patients go through multiple medication trials without relief, it takes a massive physical and emotional toll. In the clinical world, this persistent, stubborn struggle is known as treatment-resistant depression. It's that awful point where many individuals feel completely stuck, like they've literally exhausted the traditional medical playbook. But here is the absolutely crucial takeaway. While traditional medications might have stopped working, treatment-resistant does not mean untreatable. There's a very bright beacon of hope here, and spoiler alert, it doesn't come in a pill bottle.
Section 2. What is TMS therapy?
All right, transcranial magnetic stimulation, or TMS for short. This is an FDA-approved treatment that uses magnetic fields to stimulate the specific areas of the brain associated with depression and mood disorders. So the really crucial point here is that this is not some experimental guesswork. Not at all. It is a clinically proven FDA-approved breakthrough that targets the brain circuitry directly, rather than, flooding your entire body with chemicals.
To give you a little context, TMS might sound like something straight out of a sci-fi movie, but its roots actually go back decades. In 1985, it was first developed by Anthony Barker and his colleagues at the University of Sheffield as a non-invasive way to stimulate the brain. Fast forward to today, and it's widely used and FDA-approved not just for depression, but it's also being leveraged for anxiety, trauma, and even dual diagnosis care and addiction recovery. So it is firmly grounded in decades of rigorous neurological research.
Section 3. How magnetic pulses rewire mood.
Now, what's really interesting about this whole process is the physical mechanics of the procedure. They are incredibly elegant. Step 1. A device coil is positioned over a specific part of the scalp, usually targeting the left prefrontal cortex, which is basically your brain's command center for mood regulation. Step 2. Brief, targeted magnetic pulses are delivered, passing right through the skull to induce small electrical currents. And step 3? Well, this is where the magic happens. Neural activity is modulated. In depression, certain brain circuits become sluggish or underactive. So you can think of these magnetic pulses not as a shock, but as a gentle waking up of those dormant mood regulation circuits, which helps restore balanced signaling.
Section 4. Safe, non-invasive treatment sessions. When deciding on a path forward, the comparison between traditional meds and TMS is often the real game changer for patients. Think about it. Traditional medications come with systemic side effects because, well, a pill has to travel through your entire digestive system and bloodstream before it ever even reaches your brain. But TMS therapy, it is entirely non-invasive. There's no surgery, no needles, absolutely no anesthesia required. Because it only targets the specific area of the brain causing the depression, you avoid those heavy whole-body side effects entirely. How amazing is that? So, what does a typical session actually look like? Well, you go into the clinic, and the session lasts just 20 to 40 minutes. You remain fully awake, comfortably seated in a chair. During the treatment, you'll hear a clicking sound and feel a gentle tapping sensation on your scalp. And that's literally just the magnetic pulses doing their job. In fact, it's so low-key that many patients read a book, listen to music, or just relax during the procedure. And because there's zero downtime, as soon as the session is over, you can drive yourself right back to work or return to your daily activities immediately. Now, I really want you to think about this number, 20 to 36. TMS isn't a one-and-done magic trick. This number represents the typical amount of sessions a patient will need to achieve optimal recovery results. Usually, these 20 to 36 sessions are spread out over 4 to 6 weeks, going about 5 times a week.
It's a commitment of time, absolutely for sure, but it is a highly structured, finite plan designed to progressively rebuild and strengthen those neural pathways for lasting relief.
Section 5. Real patient success stories.
Let's move on and see how this builds into real-world outcomes. This is perhaps the most striking number in our entire explainer: 60 to 70%. Clinical studies show that roughly 60 to 70% of patients who undergo TMS experience significant clinical improvement in their depression symptoms. And what's truly remarkable here is that many of these patients achieve complete remission. Remember, these are individuals for whom multiple medications completely failed. To see a 60 to 70% success rate in that specific group, that is nothing short of revolutionary.
Let's look at what that 60 to 70% actually sounds like in real life. Sarah M. shared, TMS therapy gave me my life back. After years of struggling with treatment-resistant depression, I finally found hope and healing. When you understand the science of waking up those dormant brain circuits, you can really understand how profound this result is. It's not just managing symptoms anymore. For people like Sarah, it's literally getting their life back. Here is another perspective, this one from Jennifer L. She says, when medications stopped working, TMS offered a new path forward. The staff made me feel safe and supported. And, this perfectly reinforces what we discussed about the treatment experience earlier. The non-invasive nature of the therapy, just sitting awake in a comfortable chair, it allows for a supportive environment where patients feel entirely safe throughout their entire healing journey.
And this next story brilliantly illustrates another vital application of TMS. Michael R. shares, the combination of TMS therapy with my addiction treatment program helped me address both my substance use and underlying depression. TMS is incredibly effective for dual diagnosis care. Very often, individuals use substances to self-medicate their severe depression. By treating the underlying underactive brain circuits simultaneously with addiction recovery, patients like Michael get comprehensive care that treats the whole picture, the whole shebang, not just one isolated symptom.
So as we wrap up this explainer, I want to leave you with this final thought. Is it time to explore a new path forward for your mental health? If you or a loved one have been caught in that frustrating cycle of medications that just aren't working, I really hope this deep dive has shown you that science has opened a new door. TMS is safe, it's scientifically sound, and it is bringing light back into lives that have been dark for far too long. Thank you so much for learning with me today, and hey, never stop exploring the options for your well-being.